I wrote this book with some specific purposes in mind. I wanted to describe the current state of what I've seen in healthcare, where it is viewed and where there's much evidence to suggest healthcare is unsafe. And rather than a system approach to the solution of that through process improvement and all of the many processes that must be improved, I wanted to take a systematic approach to look at how our own human factors, our own relational factors contribute to the current state, and how it is within our own direct control if we saw that and understood that and chose to show up in a different way, where it was expected that we showed up in a different way, would have a dramatic impact on creating safer conditions for our patients in a systematic fashion. In other words, I'm talking about a culture change of an organization that begins with this idea that how we show up matters in our ability to take care of patients, and that how we show up needs to be much more team-focused, much less individual-focused. When we become much more team-focused and we begin to understand the importance of respect, and we understand the importance of taking the time to listen and learn and understand and maybe even ask questions more than we're giving answers, we begin to create a safer environment for us to discuss the care of our patients and get on the same page. Those are the kinds of examples that I want to teach, and I've chosen a kind of a storytelling, business novel approach to tell the story of Edie, a patient who goes in for a fairly routine surgery, and through all of the behavioral faults that I've just alluded to, is tragically subjected to a wrong site surgery that leads to her death. And then it's about the rolling people under the bus, the self-protection, the defensiveness that ensues, and then how somebody who comes in as a patient-driven leader, talking about the importance of role clarity, talking about the importance of being a teammate, treating people with respect, taking time to listen, creating safe conditions, could have completely changed that outcome. Not only that one single outcome, but every time we get in the habit as a team to come together and take care of a patient, focusing on this idea that what matters most to patients determines how we practice as leaders, we can control our own destiny, create the kind of safe healthcare environment that we require, and do it in a way that doesn't add to our already overburdened workloads.